There are 390,000 people with kidney failure on dialysis today. 71,000 people are waiting for kidney transplants in this country. I'm joined by Dr. Ervin Ruzics, Director of the Kidney Transplant Center at St. Joseph's Hospital, and his patient transplant recipient, Claude Jenkins. Thanks for both of you for coming today.
Thanks for having us, Larry.
Thank you. You know, this is an amazing statistic, that many people on dialysis. I don't think people realize what is the biggest cause of kidney disease today.
Well, you'd be surprised to find out that advances in medicine have probably contributed to an increase in kidney failure, because right now the #1 cause is diabetes. So patients with diabetes are living long enough for the diabetes to affect their kidneys and put them into kidney failure. Second most common cause is said to be hypertension, and then we have a class of diseases we call glomerulonephritis, and that's the top 3.
And how does a patient know they have kidney disease? What are the symptoms? Are there any?
That's one of the biggest problems, is most people need only about 30% of the kidney function they're born with to be perfectly healthy. So a lot of patients don't seek medical attention until they're down below 20% when it's too late to do anything.
And so how would they know it's at 20%? Is it by a blood test, or are they having fatigue, or what are the common presenting symptoms that would send them to a doctor?
Patients that go to the doctor will have a routine blood test. It'll become evident. Sometimes on a school physical or an insurance physical, they'll notice protein in the urine, and these are the early warning signs that the kidney function is declining.
Now, we have dialysis, and what happens with dialysis? Why is there a problem? Why can't you just stay on dialysis forever? What happens to your body?
You know, dialysis as we have it in the United States is really a medical miracle. It's a great treatment. None of those 390,000 patients would be alive if it wasn't for dialysis. But dialysis provides approximately 12% of the function that the kidneys used to provide to the patient. And for most patients, that's just not enough. Patients feel weak and tired, run down, and their lives are substantially shorter than they would have been if they didn't have kidney failure.
Claude, you look fantastic, and you're a kidney recipient, right?
Yes, sir.
And you're a patient of Dr. Ruzics?
Yes.
And actually, you look better than Dr. Ruzics, I must say.
I'll do to Dr. Ruzics.
Why don't you tell us your story?
My story, I was going through the process with my sister, and what seemed like at the last moment to me, he put the kibosh on it because she had an issue with her heart, I believe it was, or blood pressure, I'm not certain. So the first time around, it was a no-go. And I appreciated that because I knew he was looking out for my sister as well as for me.
Right.
They're really concerned about the donor. So I had I had a donation from my 20-year-old niece.
Wow.
One of the other things that you mentioned about earlier was how does a patient know, how does someone know when they're having a problem with their kidneys or kidney failure, etc. For me, it wasn't one of the issues of feeling necessarily tired, etc. I woke up one morning to use the restroom, and I had blood in my urine, quite a bit of blood in my urine. That's how I found out that I, in fact, had a kidney disease. I had a disease called polycystic kidney disease.
So now you're back. How many years are you post-transplant?
2 years post-transplant.
And was the surgery painful to you?
Surgery was not painful at all. The surgery, well, for me anyway, the surgery was a breeze. I didn't perform the surgery, obviously, but surgery was a breeze for me. I was up, I believe, the same day, and I was out of the hospital within 3 days.
3 days after
3 days.
kidney transplant?
Absolutely.
Wow, that is amazing. And you are doing everything you ever wanted to do before?
Absolutely. I'm a few of the biggest things about once you receive a kidney transplant, and I don't know, for me, the biggest thing, I wanted to have a kidney transplant for my family. I know that may sound a little weird, but the biggest thing for me was being able to participate in my kids' lives again, to sit down to a meal also, and not have to worry about taking a particular medication that I had to take because I was on dialysis. So there are a lot of swimming with my kids, just so many things.
So how difficult is a transplant? I know it's technically challenging, and there's rejection drugs, but is it better to get the kidney from a cadaver or a living recipient? Well, a living donor, I mean.
Every patient who qualifies for transplantation, every one of those 71,000 is put onto the national waiting list to wait for a kidney from what we used to call a cadaver donor. Now we call a deceased donor. The only problem is each year there are maybe 10 to 11,000 deceased donor kidneys available. So there's such a severe shortage that it leads to a very long waiting time. And here in Southern California, somebody with the most common blood type O, might wait 10 years. And you know, even though he may be the cream of the crop of the dialysis patient to get to the waiting list, his mortality on that list is going to be 7% every one of those years. So all the patients that go onto the waiting list of his blood type, by the time the first phone call comes in, 70% of them are dead. And the 30% remaining, there's no guarantee they're still candidates. So clearly, the best thing that could happen to somebody is to have a living donor, because transplantation can be performed right away.
How risky is it to donate a kidney? What is it? How, you know, is it a big, gigantic incision? Are they in the hospital for 2 or 3 weeks? How risky is it?
Living donation is the safest major surgery in the world.
Wow.
And not because anybody could donate, but because we've developed such a stringent selection process to pick those patients who will sail through the donation operation and who will have a normal life with one kidney.
That's amazing. Now, you and I share a lot of patients. Often they have to be screened for heart disease, and
Correct.
sometimes I'll do an angiogram and they'll have like one artery that's partially blocked, and you say, listen, we should still transplant this patient because that heart disease is going to get worse on dialysis. Is that not right?
That is correct.
Yeah.
Yeah.
Now, when you have a kidney transplant, your life is much better in a lot of ways. Not only is the quality of your life better, but you live longer than dialysis. What is the statistical average in life expectancy with a transplant versus dialysis?
As I mentioned, dialysis provides about 12% of the function you're born with. A single kidney in a transplant will give you somewhere between 40 to 70% of your old function, and as I also mentioned, all you need is 30%. So you've essentially had a cure for whatever ailed you as a consequence of not having enough kidney function. Now, it doesn't fix all the problems that patients with kidney failure have, but it fixes that, and it makes high blood pressure better. So patients that get a transplant typically will tell us that they feel normal again. Now, I don't know if that's true, but that's what they say, and the net result is they will live twice as long as they would have lived on dialysis.
Twice as long?
Twice as long.
Wow, that's
yeah.
huge.
Patients who qualify for transplant are a very, very select group. As you mentioned, there were 390,000 people on dialysis, but out of those 390,000, only 71,000 qualify for transplant, meaning we think they have a reasonable chance that they will survive a transplant and be made better by it. And the people who qualify for transplant will survive an average of 10 years on dialysis.
Now you have
if we give them a transplant,
Yeah.
it's 20 years. So it's double the life expectancy on average.
20
and we see people go 40 years.
really life-altering. I mean,
It's absolutely life-altering.
Life-altering.
No doubt about it. The quality of life for me had just improved dramatically. I can't overstate how much it changes your life.
Claude made some great points. Number one is the family issue. Because when we do a kidney transplant, we're not just making the patient better.
Absolutely.
You know, some families are not as lucky as Claude's family in that Claude was still able to go to work. Most patients with kidney failure on dialysis are absolutely unable to go to work, and the whole family is affected by this. And so when we do a transplant, we don't just cure the patient, we cure the family. And this is something that's very important for the families to understand, because so many times the recipient is reluctant to accept an offer from their children or their wife. They don't want to take, they're used to giving, but they're actually giving by accepting that donor because they cure the whole family.
And that was a tough thing.
Yeah.
My niece was 20 years old.
Yeah.
My niece was going to school. The day before my surgery was her son's 1-year-old birthday, husband, the whole thing. So she's a busy lady, and she still took time out.
Claude, Ervin, thanks for coming today. You have a great story. You're doing well. You look fantastic. And Ervin, you ought to be congratulated on your success. I mean, you have one of the best kidney transplant programs in the country, and it's up to you and your staff. You know, it started, we've been trying to get a